Namaste everyone, I am Dr. Vishakha, Senior Consultant Pediatric Neurosurgeon, Rainbow Children's Hospital, Hyderabad. Today we will discuss about the brain tumors in children and how the recent advances have improved the outcomes in children. Brain tumors are the most common solid tumors in children. They differ from adults, the way that they arise from different locations, they respond differently, and their cell type is different. So the most common brain tumors which occur in children are medulloblastomas, ependymoma, craniopharyngiomas and gliomas. And most of the children, the common presenting symptoms might be developmental delays, headaches, vomitings, nausea, sometimes walking difficulties, and vision disturbances, seizures. Recent advances in pediatric neurosurgery has revolutionized the treatment of brain tumors in children. Some of the recent advances, what we regularly use during our surgery is neuronavigation. So neuronavigation is a GPS-like system which will help us to exactly locate the tumor and resect it or remove it safely, preserving the important structures. The next advanced gadget what we use is fluorescence guided microscopy, where we inject some dye in the patient and then that dye will be taken up by the tumor cells and the tumor cells will glow, whereas the normal cells will not glow, and here we can differentiate the tumor cells and we will do the resection, the excision safely. The next advanced gadget what we use during surgery is fluorescence guided surgery, where we inject the dye and that dye will be taken up by the tumor cells, helping us to exactly detect the tumor tissue and preserving the normal tissue and increasing the safety of the surgery. We also use a lot of functional mapping techniques where we exactly locate the important functional areas in the brain as for language, for motor functions, for sensory functions, and once we locate it, we try to preserve it and thereby reducing the neurodeficits developing after surgery. We also use a lot of minimally invasive techniques, including endoscopic techniques or endoscopic approaches, which will reduce the time of the surgery and also the size of the craniotomy of the surgery. So all these advanced gadgets have helped to give a better outcome after the surgery in terms of higher rate of complete removal or safe removal of the tumors, reduced risk of complications, reduced hospital stay, and reduced morbidity in terms of neurological disabilities after surgery, and better long-term outcomes, better quality of life and improved long-term outcomes. So if your child has any of the symptoms which I mentioned, do visit your neurosurgeon at the earliest and get the help. Thank you.